So the immunomodulator class of drugs work to suppress the immune system. When you have inflammatory bowel disease, this is an autoimmune disease. So our immune system is attacking our bodies, specifically our GI tract.
My understanding is it really is sort of a systemic immunosuppressant, so it's impacting the immune system's response to something that's invaded the body, so to speak. In an autoimmune disease, it would be, your immune system is attacking your own tissue. So it's trying to suppress that reaction.
They're there to suppress the immune system, to bring down the inflammation, so that hopefully your disease can get into a remission.
There's quite the process for starting it and making sure you've got your live vaccines and things like that before starting that medication, just because you will be immunosuppressed.
When you are on immunomodulators, your healthcare professional will definitely tell you to be careful. You're more susceptible to catching things that are going around.
It comes in pill forms. So I've been on Imuran or azathioprine for 20 odd years. My experience has been positive. I've had no adverse reactions to being on Imuran.
I think they worked for me, I want to say for a couple years, and then they were no longer effective.
I was really sick in the beginning when I was first diagnosed. They really had to pump me up with steroids and Imuran just to bring it down, and because it was very aggressive at that point. Imuran lasted maybe a year, and it wasn't helping. It wasn't helping me go into remission. So I was put on 6-MP, which was an injectable. I didn't last long on that, maybe about 6 months.
I was on 6-mercaptopurine for probably a good 10 years. I got off of it when it triggered my liver to really, really stop working.
The gastroenterologist said to me in the office, we need to try this because insurance says so. We need to give it a shot before we can move on to anything else. It doesn't always work well for everyone, but if it does work, then there are people who have stayed on it for years and had great success. I took the Imuran and I had a violent reaction. I just remember sitting at the kitchen table, not eating because, I'm ill, and I was sweating and gross from taking these new pills that did not work for me. So I stopped, but it took a few days for them to get out of my system.
With all the medications that are available to people with IBD, every one of them comes with warnings. And it's kind of like a legal or moral obligation to explain to a patient all the things that can happen.
You have to be really careful with your health. I felt very fragile.
It's in the name, immunosuppressant, immunomodulator. It does modulate your immune system, so you are more prone to pick up random things.
In my case, I had no adverse symptoms. I wouldn't say that I get more colds than anybody else.
I had pretty significant side effects. The rarest, when you read the drug manuscripts and it says 0.01% of the population will have these. I had those, for example, nosebleeds profusely. I lost my hair, not entirely, but enough.
I lost a lot of hair. That was the main side effect I remember having.
Imuran is understood to increase the risk of certain cancers. So I would be monitored or tested for this increased risk, which includes skin cancer. So I go to a dermatologist at least once a year, and I've had things removed. But on balance, I'd rather have good gut health and put on sunscreen and go to the dermatologist as the price to be paid for it.